Hi guys, welcome back to my channel. Yeah, you're welcome back. And what is today's topic? Today's topic is female genital mutilation, otherwise known as female circumcision. Yeah, this practice is being done worldwide. In fact, record says that over 4 million girls undergo the risk of female genital mutilation each year. Yeah, so in this course today, we'll be talking on female genital mutilation. Why do people carry out female genital mutilation? The short-term effect of female genital mutilation and the long-term effect of female genital mutilation. Should this practice continue or it shouldn't continue? Yes, so this is all what we'll be looking on this channel today. So let's go there. Please, if you've not subscribed to this channel, subscribe to this channel and click on the notification bell so you'll be the first to know when next I upload my videos. Yeah, so let's dive into the topic. What is female genital mutilation, known as female circumcision? Female genital mutilation is the removal of a part or the whole of an external genitalia of a woman. What does that mean? It is the removal of some parts, either the clitoris or the labia minora, or removal of all the external organs in the female vagina or female genitalia. So that is female circumcision. And why do people carry out this practice? Most people carry out this practice because they feel that it secures them. Yeah, it secures their children from being promiscuous outside. Yeah, and some even carry it due to cultural beliefs and values. Some parents believe that since they too underwent that, so their own kids too have to do that also. So they believe it's culture. Yeah, that it's been done right from the Stone Age up till now. So that is why most people carry out this female genital mutilation. So let's dive straight into the immediate side effects of female genital mutilation. What are the immediate effects? One, it leads to severe pain. Female genital mutilation leads to severe pain because most of these people that carried out this stuff, they don't even administer any anesthesia to this patient because they are uneducated. Yeah, so they just cut them, stitch them, and leave them there. So most patients undergo severe pain. And the next is bleeding. Most patients undergo bleeding because they are being cut. Yeah, they are being cut using some sharp object, knife, razor, anything, as long as they are being cut and nothing is being administered. So excessive bleeding is a must during female genital mutilation. And the next is infection. Most victims are being infected. Yeah, because this equipment that are being used on them might be used for others. Remember, these people carrying out this circumcision are uneducated people. They might use it for this person, also use it for another person. They don't sterilize the equipment. So most patients end up being what? Being infected. Yeah. And the next is difficulty in urination. They have difficulty in urinating because after you've been stitched, cut, at that moment you can't be urinating. In fact, even if you're pressed, it makes the whole female genitalia to be swollen. It causes swelling. Yeah, so it even causes swelling to the extent that it gives them scar. So most of these patients have an everlasting scar that it's always on, that will always be there. And the next is death. So a patient cannot undergo bleeding, pains, shock, difficulty in urination, and not end up dying. Most patients end up dying. So FGM causes death also. So having said that, let's move straight to the long-term effects. Long-term effects is difficulty in passing out urine, which might even lead to renal failure or kidney failure. Yeah, I've heard of a story that someone was rushed to a hospital. Yeah, that she has not been passing urine for some days, just for the nurses to check or the doctors to check, and they discovered that there is no space in her vagina self for urine to come, because she has undergone FGM. Like everywhere was stitched, even for them to pass in catheter, so the urine will be coming out from there. There was no way. So after diagnosed, and they discovered that she's having a renal failure, which is a kidney failure. So FGM causes kidney failure, because when you stitch everywhere, you close everywhere, you even cut out the clitoris, so there won't be anywhere for the urine to come out. And you know, when you accumulate urine inside of you, it causes renal failure. Yeah, because that is where it passes through. The kidney filters it and it comes out. So if it keeps refluxing back, definitely it's going to cause renal failure. So FGM causes what? Renal failure. And the next is difficulty during childbirth. Yeah, most people have difficulty during childbirth, because why? Everywhere has been stitched. So during childbirth, they cut them open again, so the babies can come out. So imagine, even during sex, before they could even have sex, they had to cut them open again, so they could have sex and bear children. And it even affects the children to the extent that the children will be weak, because after undergoing several pains, several hours of labor without even giving birth, definitely the child is going to be weak, the mother is going to be weak, and they might even end up dying. So it causes difficulty in child delivery. Another long-term effect is that it plays with your sexual health. Yeah, it's just will not make you have pleasure during sex, or pleasure during penetrative sex. In fact, because you won't even have any urge, or there won't be that emotions for sex anymore. Yeah, because the things which are supposed to give you that urge are being cut off, they are being chopped off, like the clitoris. So there won't be that sexual urge, no pleasure during sex. So it's going to play with your sexual health, and definitely it makes your husband to go outside or look outside. So FGM affects sexual health, because there won't be pleasure during sex, there won't be pleasure enjoying anything, because in fact it will be just pains upon pains. And whenever they talk about sex, you won't even think of having it, because you know what you're passing through. And the next is infection. Just as I said earlier, due to the use of unsterilized equipment, it can give infection, STDs, STIs. Get. So FGM gives what? Infection. Yeah, maybe somebody is infected with HIV, hepatitis, and the equipment are being exchanged. So definitely you're going to be infected in life. Yeah, it causes infection. FGM also causes infertility. Yeah, it causes infertility due to pelvic inflammatory diseases. Yeah, that can result to infertility. So please, these are the effects of FGM, and how can we stop this practice in Africa, in fact in the world? One is by creating an awareness. Yeah, educating, like me and my CDS group. Yeah, we've been out there in schools, on the streets, yeah, educating people on FGM and the effects of FGM. FGM shouldn't be practiced in our society today, because it even affects the mental health of that child, because that child is going to live forever, you know, thinking of how bad she is, how bad her sexual life is, how bad the kind of pain she's been feeling. In fact, if this child ends up being infected with all these deadly diseases, she's going to live her life miserably, because there won't be anything good for her to live anymore, all because of one cultural practice. Please, parents, if you know you don't want your child to be promiscuous, give them early sex education. Not for them to undergo all this only because you don't want them to go out there and meet some men. Give them early sex education. We know we are Africans, we don't want to talk about that, but it's high time we started talking about this. Yeah, please, let's give them early sex education. Thank you for staying with me today. Please, if you enjoyed this video, give it a thumbs up and don't forget to click on the notification bell so you will be the first to see when next I upload my videos. Thank you and see you in my next video.